Okay, the other type of fluids that we talk about sometimes are colloids. And colloids are large molecules that enhance the ionic pressure. We talked about ionic pressure in another video about how plasma helps with the ionic pressure. So basically what this does, colloids do, is they stay in the intravascular space. They can pull fluid from other body compartments, so if there's a patient who is compromised, you really should have crystalloids and colloids going together. They use these in hypovolemic shock because they need that ionic pressure going on. They also use it with chronic diseases like hypoproteinemia. That's because they don't have a lot of plasma. There's not those plasma proteins in their blood. So some types of colloids that we use. There's natural colloids. So natural colloids, these are whole blood, also called WB. These are from a donor. They do need to have typing. And you can't just go give whole blood to a dog. There are different types of blood types for dogs, so you need to make sure you type them. You need to deliver them to the recipient with via a blood transfusion set. Okay. You want to use an isotonic solution with when you're administering whole blood, preferably saline with the 9% saline, 0.9% saline. There is one thing about whole blood. You have to remember that the longer it's stored, the more fragile it is. So a lot of times clinics have donor animals. So it's a technician or a doctor's dog or cat. Those are the ones that donate the blood. So they'll actually bring in the animal to donate and use the blood immediately. Once it gets over about 5 days, it's really fragile after that. It still has some use, but it may not have the use that they're looking for. There is packed red blood cells, so PRBC. These last about 42 days. They still need to have typing, and they use these in immune-mediated hemolytic anemia, mycoplasma haemophilus, which is also called Bartonella. They use that also for chronic anemia. You do need to use an isotonic saline with this, and you have to still do that blood typing. They do last a little bit longer, and they can help with the delivery of colloids, or of red blood cells, and help with, if they have problems, you'll notice that they'll have a decreased oxygen count, because they don't have enough blood in their body to help oxygenate. So some other types of natural colloids you might see, fresh flows in plasma, or FFP. These are separated from the white blood cells, or the whole blood, and frozen within 6 hours. These do have coagulopathies, so they have coagulation factors in them. They use these in patients who have coagulopathies, like a vitamin K deficiency. Usually this comes from patients who eat rodenticide, right? Plus or minus pancreatitis, sometimes they say that works, sometimes it's not. There's no real studies done that show that it actually does work for them. They can be stored in -20 degrees Celsius for 1 year. Stored plasma, or SP, this is separated from whole blood. The thing is that it's missing the coagulation factors. So the difference between fresh frozen plasma and stored plasma is that stored plasma does not have coagulation factors. It does still have albumin and globulin in it though. They use this to treat hypoalbuminemia, which means they have a decreased amount of albumin in their body. And sometimes they'll use this in conjunction with with packed red blood cells. Okay. This has a longer shelf life. If it's stored at 18 degrees Celsius, it can last for about 5 years. Human serum albumin, HSA, this is from humans. They do test it. You should still use proper PPE when you're using this product. You need to assume that it's contaminated. So always make sure you're wearing gloves. Don't eat it. Don't squirt it in your eye. Okay. The nice thing about HSA is a small amount of it can give you a really large effect. There is some drawbacks though. It is kind of costly. there is a chance that there is adverse reaction. So you need to make sure you're watching that. So there's also some synthetic colloids that we can use. There's dextran. They use this for rapid vasculature volume expansion. Basically, it helps to give a lot of volume very quickly. You want to remember to draw blood before you do, if you have to do a transfusion, you want to draw blood before you give the dextran because it can alter the results. So the next one is hetastarch, and this remains in the plasma for about 36 hours. So it stays there for quite a long time. You do need to check for an allergic reaction though, and it'll happen at about 15 to 20 minutes post-administration. There is a final synthetic colloid, and this is a really nice colloid. Sometimes it's very difficult to get. It's called oxyglobin. It's a hemoglobin-based oxygen-carrying fluid. So basically, it causes the vascular volume expansion, and it remains in circulation for about 24 hours. And it helps with oxygen. So they need to be oxygenated because they have low red blood cells. This helps with oxygenation. But it can cause vasoconstriction, which can increase the blood pressure. So that is something you need to remember and be aware of. It does have a long shelf life, lasts about 3 years just sitting on your shelf. Okay. The side effect to using oxyglobin can be vomiting and diarrhea. Again, you need to draw blood before you administer it, especially if you're thinking that in the future you may need to do a blood transfusion. These 3 products do not need to be typed, so you don't need to be doing typing with these. If you have any questions, please let me know. Bye.